No more Dr. Hlati here in Malamulele. There will be no more Dr. Hlati.
Hlati was known for being a passionate proponent of the use of indigenous medicines all his life. His family says while Hlati will always be remembered for his good work and unwavering promotion of native knowledge, he was also a caring father who loved his family. Colloquially known as Mbayimbayi, Hlati was described as a tolerant man who respected his children's choices.
Professor Hlati, he was a family man. He loved his wives. He loved all his children from the different wives. He wanted to see all his children prosper. And he chose one young boy that when he passed on, is the one that must take over all the traditional healing profession. The reason the elder ones didn't want to go through those things, but he taught everybody at home that to respect other people, also to respect people's professions. You know, as traditional healers before him, people used to undermine the traditional healers.
Other faith leaders say Hlati was an open-minded traditional medicine practitioner who worked closely with people from other religions.
He was able to communicate when his time come, you know, because we were doing that, being me. We were three by that time. For those who are for Islam, represented by Brother Malayani, Rembrandt, and then the traditional one represented by Dr. Hlati, and then I represent Christianity. So he will communicate from Europe. Recently, he was at Brazil, you know, and then he had to communicate where people wouldn't know that he's not there in Polokwane, in the SABC complex. And then, but he was featuring well. He will understand. That's why, you know, when we work, we were not working, you know, as if we are arguing.
The Department of Health in the Malamulele area has hailed Hlati for his dedication to fostering unity between clinical officers and traditional healers.
Our relationship as the Department of Health with Professor Hlati has been a very good one. It dates back in the early 2000s, and to be exact, around 2005, when the HIV and AIDS program started, the rollout of ARVs. So it was a requirement according to our National Health Act. You will know that we've got the National Health Act number 61 of 2003, that in whatever we do, we need also to have traditional leaders as represented in our hospital boards, as represented in our multidisciplinary teams. So that's how we were working with him. And also recently, I think he was into his second term of the hospital board. We were in a meeting with him on the 5th of November. When we heard of his passing away, it was really heartbreaking. And we were quite, affected.
Other traditional medicine practitioners say Hlati paved the way for them to practice with liberty.
I tirhe kahle nkulukumba loko pfuletele tivanti leti ti pfariwile hi kota ku nghena hinkwako ku na laha ka hi nga nghenangi hi ku nghenisa hi nkulukumba lowu se vutlhari bya yena na swikwembu swa ka vona na vandhawu va yena a va n'wi seketerile.
Hlati will be buried in his country of birth, Mozambique, on Thursday. Rutendo Bobori, SABC News in Malamulele.